why we are here doing this thing called chiropractic. When we are taking on a patient, they are entrusting us with being their doctor. They are trusting us to help guide them through this time in their life, this condition, this subluxation, this situation that is really pulling the love and the joy out of their life. They're taking that serious. We should be doing them a service as one of their doctors of delivering the very best care that we are able to do for them. So I am Dr. Wilson. I wanted to make sure that today I went through how crucial it is for us to maintain the why we got into chiropractic in the first place, the why we wake up every day, head to the clinic, and give our all for our patients. But we got to make sure that we're actually giving them our everything. We oftentimes will start to hold back because of fears that are in our head, or preconceived notions of whether this patient could afford our care, whether they really need more than 2 adjustments, or the national average of 6 to 8 adjustments in a lifetime of a patient. That is a terrible patient visit average. So within AMC and Aligned, we have a protocol that helps us get our mind straight. We call it the oath. It is an oath that we should read before we put together a care plan, before we sit down and fill out that paperwork of what is our recommended care plan. You brought me this condition, patient. Here's what I can do for it. This is what it's going to look like. But having your head in the right space when you go about putting together that care plan is everything. Every patient deserves our best. Reading the oath makes sure, it ensures that our heart and our head are in the right space to actually recommend what is truly in the best interest of that patient's condition. Don't sell them short. Over treating is not a good thing, but neither is under treating. And that's where I find many of my colleagues falling into that category of under treating patients. Now, we know as chiropractors, if you've been around for a minute, you know chiropractic works. You know the beauty of this profession. Our bodies have been given such a powerful, innate ability to heal themselves. Chiropractic works. So, undertreating is what we will often have going on that will lead to patients not getting the outcomes that we want to see as doctors, and the outcomes that the patient wants to be seeing as a suffering person. So when we start to fall on that undertreating, minimizing their condition, minimizing their treatment program, you're going to find more and more patients not getting the fantastic results that you should be seeing in your office, not getting the fantastic transformations that those patients should be seeing in their lives. So, read the oath. Get a habit of reading that oath every day before you put together a recommended treatment plan, a course of action. Get your head in the right space and ignore all the variables. Ignore what that patient has been through. Ignore the life circumstance that you think that they might be in. Ignore whether they have an insurance coverage or not. Ignore everything. Don't try to be their financial advisor. Don't try to be their social worker. They need you to be their doctor. Desperately. More than anything. So be the doctor. Doctor, put together a treatment plan that's appropriate for that person. A treatment plan that helps ensure their success above and beyond any other method. So recommend the very, very, very best that you can do. And most importantly, just like it says in the oath, let the chips fall where they may. That's a hard thing for some people to do and accept at first. But It's so liberating. It's so freeing to have that attitude towards your practice. I will always show up and give my very best to patients and let the chips fall where they may. And what you're going to find is when you have an awesome system in place, awesome procedures and protocols, like the aligned system, when you let the chips fall where they may, you will find that most of those chips, the vast majority of those chips, fall right in place in your practice,